there is already something done on the process to improve this. And take cue of what they have done in examples. What they do is really to, you can tell over the 3 cases, it's not about blaming the case. We want to learn. So what you can learn from all the 3 cases right now, you can see is that humans do play a role. We are very active in creating the error. It's by facts, evidence says so. But it also means they have subconsciously created process engineering. All the 3 cases, they have subconsciously created process engineering to improve the process itself in reducing the chance of the same incident happen again. And that is the important learning that we need to take home today. So it also tells you that knowing the ability of the staff, the human, the weakness of a human, the limitation of the environment, the process, it helps you think. And education alone is not, now you understand why earlier I said education is not so effective. It's something we want to do, but it's not the most effective. You can see all the examples. Even if you do education, it's not going to improve that unless you design process engineering. So you do 2 things. You do education, you also do process engineering. That will strengthen your strategy and your approach to improve those process and error so that we can really reduce those preventable harm, right? So very good examples, and I think it totally illustrated what we want to share today and how those thinking should be when we look at total system safety perspective. Don't just look at straight the case and the human. Dive deep in, look at more. Okay, so congratulations. Thank you so much for sharing.
Eric, I have a question, and also Rebecca also. Because of the first time that you mentioned this is, if this case is not human, if this case is about the lab, just as the machine that you're asking how to check the machine, if the specimen storage like this, can you provide the detail about this?
So if we change the story, and the human never make the error, and now the machine make the error. So number one, the first question to ask is, why is the machine showing the wrong indication of the microbilirubin reading, correct? That's the first question you ask, right? Then the answer could be, the machine is not clean. All analyzers needs to be clean. Or maybe the reagent is not good. Or maybe we didn't prime the machine well. Maybe the machine didn't go maintenance. Maybe the machine is broken, but nobody knows. Right? So all these are additional questions. Now, when you say the machine is no good, then the next question is, why is the machine no good? Who is supposed to make sure the machine is good? That's the next question. Oh, because we never have a biomedical engineer and we don't have no technician. So nobody fix the machine. We just use alcohol wipe, clean, press the reset button, and then press the daily prime button. Okay, I'm good for the analyzer. That's what maybe you do every day, especially with your POC. Be careful with your POC equipment, point of care analyzer. Be very careful. Need clean one. POC also need clean. You don't just, no maintenance, it will give you wrong result. Then at POC, wow, high glucose, then you start to diagnose the patient wrongly again. Many of these instances has happened. Then when you start to dive in, why is my machine so bad? Then you start to look at, because you have no maintenance. You never signed contract with the supplier to come do maintenance, or you have no engineer to do maintenance. Then what to do with the machine? Wait for it to go wrong and wait for it to give you wrong result. That's what you're waiting for. Then what should we do? What should we do? So you have to come up with new plan, new strategy to manage this risk. This machine today, okay, not spoiled yet. It will damage and spoil soon. But before you reach there, before it happens, then you have to ask a question now. If I have a machine, I got no engineer, no technician, no service contract, then what should you do? Because machine like car, yeah, why you send your car for service? Don't send service, keep in the house and drive until the car cannot move. Why you send your car for service? So medical equipment needs service too. So what do? Maybe we have service, but the person who does service is not very good. Always say no problem, but I always see the machine problem. Then what do? What is the next step? Does the director of the hospital know what is the next step when my analyzer is not working? We call the supplier. Then what do you want the supplier to do? What do you want the supplier to do? What is the plan? And if there is an emergency, example, if there is a tsunami, and then you have loads of patients coming down, especially in the southern area, and when you have all the patients coming in because of an emergency, then what do? How do you manage when your equipment is not performing to the level that you need? How do you diagnose your patient? How do you triage your patient? So medical equipment, so you see the hospital is a very simple. The doctor and clinical staff is one strong pillar. The facility that you have, how tall ceiling, big space, all that, the room, the facility is one strong pillar. The next pillar is your medical device. Without your medical device, you have good people, you have good facility, like this room, very nice, but no medical device. You cannot save a patient. Next pillar, process. If you don't have a strong process, how do you guide all these three to work together properly? So these are the pillars of your hospital. We can say we put all our attention and support to, we must make hospital beautiful like hotel, yeah? Very good, okay? We make sure we pay doctor good money and we keep them happy, buy them lunch, everything, make them very happy. Very good. Medical device, never mind. Unless the doctor want, we buy. If not, never mind. Process, we are all very good. These people are highly qualified doctors and nurses, very highly qualified, intelligent. So process, I think is a problem. So I don't know. This is when you start to have problems. A total system safety approach wants us to look at everything because you need to know everything is systemic. I see my hand feel pain and red because I pinch. So if I have to pinch, then I feel pain and red. It's systemic. Everything we do in the hospital is systemic. That is why we need to look at the total system approach. That's why I want you to look at it from there. So medical device itself, if you will be investigating or you will be coming up with a solution, you have to think deep into it. Everything about even the human who manage and maintain your equipment is important. There is a case, I don't know, some of you I shared before. If I have time, I'll share this case very quickly. In Vietnam, some of you may know, 9 patients died because of dialysis. And it's because maintenance were not completed properly. They were cleaning the reverse osmosis system water with chlorine. And they didn't flush everything out on time. And the maintenance people went home. Monday morning, all the patients come in for dialysis. All the chlorine go inside the blood. 18 went into ICU, 9 died. Or was it 8 died? Director of the hospital, the physician, the nurse, the maintenance people, the maintenance company, the court sent them to jail in Vietnam. So it's about everything. It's about the maintenance staff. It's about you have a protocol to check to make sure everything is clean. Why no compliance? Okay? It's about everything. So we have to think about maintenance of medical device also very seriously because If I would tell you all the kind of cases I know, I think we can sit down for the next 1 week and we can have more coffee. I can share more. And the amount of case we read and we have is ridiculously crazy. To a certain extent, I always ask myself, why is this still happening? Wrong side surgery. Not only in one country, every country we go also wrong side surgery. I want to ask a question. Are we lack of intelligence to know left and right? We don't even know where left and right, and we are in healthcare. I'm like, what are we doing? And how can we teach children left and right, up and down. I mean, we even have very nice language, inferior, superior, distal, proximal, very high, nice language we use. And yet, we have wrong side surgery. I'm like, so healthcare, is it safe? So down to this simple, we still have many cases of wrong side surgery. And we still have not find out why we still have wrong side surgery. Except we know the doctor's fault. It is the human error. And that one we know. Because this whole morning also, everything is human error. Now you know why I want to start you all by thinking about the human factor. Because evidently, using your own case, it's true. We human makes the error. Other than blaming the human, is there something else we can do to minimize the chance of making the error? That's why I want you to look at everything else when you are designing your strategy to really do risk management proper. And in order to prevent harm, you have no choice, or we all have no choice, but to be proactive. When we do learning, like what we do today, is good because we can still learn from cases, but someone is harmed. Someone already harmed. If not, where do you want to learn? It has to be some case, right? So moving in the future, we have to be better, we must be more proactive. There is no two ways about this. And in order to be proactive in these circumstances, you have to do a lot of your self-assessment. Look at the people you have, look at the process you have. No error, but every day or every month, every 3 months, look at it. Work together with the accreditation body. They have standards. They have protocols. Go research for very detailed assessment tool so that you can do your own assessment or get people to help you look at the assessment. It's not blame. There's no error, so nobody to blame. But I want to be proactive to find potential error. So doing proactive self-assessment is better when you tell your other colleague, because you're not blaming. You are proactively looking if there is any chance of other area have problem. So we will design, like the process you design, to change and mitigate those errors. So that is what we are calling for in total system safety, and that is what we really want to do in driving that.